Okay, welcome. This is the content for chapter 3 in Human Geography, GC O level, core geog syllabus. We're looking at health and diseases, and this is the content for Gateway 1. What are the global patterns of health and disease? Now, general reminder, this set of slides are the walkthrough. It is to run through the concepts with you to hopefully give you a clearer idea. This is not exhaustive. You do need to work together with the textbook as well as your own personal notes, the ones that your teachers have given you probably. I will make reference to certain pages in the workbook to give you an idea of where we're looking at. But please remember, this on its own doesn't have any details at all. Okay, this set of notes, this set of slides is meant to be an explanation to be used together in concurrence with the workbook as well as your teacher's slides. Okay, so not withholding anymore, we are going to start. Now, traditionally, students have always struggled with the health and disease as well as the food resources topic because the factors are repeated over and over again, the same factors, or you look at political factors, economic factors, and so this set of slides will structure it around a different focus. So we will look at it not in terms of the individual things, we'll have something to frame everything onto. So what we will look at is actually a situation where we will look at the various factors and concepts in this particular case KQ1 through the experiences of two different ladies in two cities. So hopefully by giving you these two characters to scaffold, it makes it a bit easier for you to understand as well as to visualize why all these different factors affect them in different ways. Okay, so the first character that you will see is what you see on the screen now. This is Layla. Layla is a 15-year-old girl from Niamey in Niger, which is a LDC, a very, very poor country in the continent of Africa. Okay, Niger is one of the poorest countries in the world. The second character that we'll be looking at throughout the entire KQ1 is Aiko. Aiko is a 15-year-old girl from Osaka, Japan. Okay, so not Africa. Can you please note there's an Africa there is wrong. She's from Japan, Osaka. She's from a DC, so she's the DC representative in this case, and Layla is the LDC representative. Now, before we even begin to look at anything at all, you have to understand two concepts that help us measure health. Okay, the first one is infant mortality rate, and then the second one is life expectancy. Infant mortality rate simply refers to the number of infants that die before reaching 1 year of age per 1,000 live births in a year. Right, the details on how calculation is done, the formula and all is found on page 177 of your textbook. Now on page 177 you will see this table, figure 3.3, which shows you DCs, examples of DCs and what their IMR rate looks like. Okay, or the IMR looks like. Right, so if you look at it very carefully, contrasting it to LDCs, the numbers do vary very significantly, especially if you look at the one that they show for Singapore is 1.77. You look at Angola is 96.2. Now this should show you and give you the concept of the magnitude of difference, because 1.77 means for every 1,000 children live births that we encounter in Singapore, only one dies, okay, before the kid turns 1. Okay, you round up, it's 2 will die. Right, if you look at Angola, 96.2, it is actually equivalent to, if you look at it, 2 classes, 2 full classes in a normal mainstream school, okay, being wiped out per every 1,000 students born. So if you think of your own situation when you have assembly in the past, okay, assuming your school is a decent sized school, you should have about 1,900 to about 1,004. Right, losing 2 classes during assembly, suddenly in the next assembly you go 2 classes are missing because they've died. That's the magnitude of it. Second concept that we need to cover before we begin looking at the health and diseases is life expectancy. Right, life expectancy simply refers to how long you expect a person to live after the person is born and living in the country for a period of time. So life expectancy varies widely between DCs and LDCs as well. Now, if you look at page 179 of your textbook, you will find the definition of life expectancy as well as where do you find life expectancy ranges. There's a chloropleth map that shows you the different life expectancies, right? DCs tend to be above 80, LDCs tend to hover between the 50s to 60s. Now, why does the health between people living in DCs and LDCs actually vary, right? There are several factors, several types of factors that can affect. Okay, so you think about Layla and then you think about Aiko, right? If you look at their diet, the lifestyle that they lead, and the kind of education they have, right? They are going to have very different experiences in terms of these three social factors. So if you look at diet, right, for Layla's situation, being in an LDC, they will be facing things like malnutrition, lack of food, okay, intake of food is not going to be enough. You look at Aiko's situation in Osaka in a DC is probably one where food is not a problem. Consumption of food is not a big issue, but they do struggle with other problems, like because there's too much food, they may suffer things like obesity and other health ailments. If we look at lifestyle choices, right, lifestyle choices actually do affect a person's health, especially this is pertinent towards the DCs, okay, who have no hunger issues. So you are not worried about where the next meal is coming from. You're worried about what you're going to eat in terms of what its taste is like, what is its nutritional value, okay, or some people just don't bother about nutritional value. So if you look at Aiko, right, and imagine Aiko's father is a person who likes red meat, okay, living in Osaka, has access to very good quality Wagyu beef. He has a Wagyu steak every night because he can afford it, but the end result is he's taking so much fat every day. He may suffer a lifestyle disease eventually, something like heart disease, diabetes. These are things that will plague DC residents. Another lifestyle choice that will lead to a lot of these long-term problems are things like engaging in certain vices, like smoking, okay, drug taking. These are all problems that plague countries tend to be DCs. Are there positive lifestyle choices you can make? Of course, being in a DC, it is always a matter of what you choose to eat, not what you can scavenge or what you can look for to eat. So when you're looking at that, you can of course choose to have a balanced diet. Your lifestyle can be one where it's healthier, where you build in exercise within your routines, and you avoid bad lifestyle choices like drinking and smoking. Thirdly, social factors wise, if you can think about education as one of the key social factors that affect your health, the fact that you are educated and you are able to know about the effects of certain types of food consumption patterns and the types of food that will lead to certain detrimental after effects on your health, you are able to take action. So if you look at once again Layla and Aiko, it doesn't mean that Layla living in Niger will have no access to education at all. She may have some access to education, however the level and the quality of the education and what they choose to focus on may not have the ability to have that kind of a positive impact on her dealing with her own health situation. Now moving on to the second set of factors that can affect their state of health, we are going to look at economic factors. Generally there are two of them. We can look at it from the poverty or affluence point of view, and then we can look at how Aiko and Layla's surroundings and the amount of investment they have in healthcare can affect their own levels of health. Now if we were to look at Layla's situation and where the background that she's living in, it looks like it is a very simple and humble abode village, okay, where the floors are mud and dirt floor, and there isn't any evidence of electrical appliances at all. So what we can infer from this is the level of affluence that she's probably living in is very low. The fact that she doesn't even wear clothing, okay, to cover her upper body. The reverse, you look at Aiko. Aiko is very much like you, okay, who is listening to this lesson here. Very, very much like you, right? I think Aiko's in the theme park actually. So the level of affluence that she is experiencing is going to be a lot more than what Layla is having. Now, how will this difference in level of affluence then affect their overall health and disease? Okay, let's assume they both get struck by a case or a bout of diarrhea. Okay, diarrhea. I think you've all had diarrhea before. Some point in your life, you are 15, 16-year-olds. You should definitely have had diarrhea once or twice in your life. So if you're like Aiko and you have diarrhea, the first thing that you probably do is you go to the medicine cupboard in your home, open up and look for whatever diarrhea medication you have, be it activated carbon, or some Western sort of anti-diarrhea medicine, or some traditional sort of Chinese medication, or whatever medication you have. Okay, there is some medication at home. What if you were Layla? Number one, the home doesn't look like it has any ability to have a form of a medical cupboard. On top of that, at the level of poverty, they may not have anything to cure diarrhea. So the long-term impact when this happens is this: you have to understand, if you do not stop diarrhea, you will continue to have the runs. Okay, what you will end up suffering is dehydration. Aiko will never reach that stage because Aiko will have taken the medication and stopped it. Layla, on the other hand, would have continued with the diarrhea, started losing water. In that kind of environment that she lives in, she may actually die. So a simple bout of diarrhea, right? Nothing wrong for you, nothing wrong for Aiko, because you are affluent enough to deal with it, to have the ability to deal with it without even having to go to the doctor. Okay, we're not even talking about doctors. Okay, will kill Layla because of dehydration. Of course, at a larger scale, you think of the overall environment that Aiko is living in. Doctors probably 10 minutes walk, or maybe a 10-minute drive away, right? If anything were be serious enough for Layla to need a doctor, it could be a 3-hour donkey ride away. Okay, you wouldn't have a car. If you walk, it's going to take you maybe 8-10 hours to reach the hospital. Somebody to carry her, right? So affluence and poverty has a very large impact. Now, the second point that I mentioned about the distance to the hospital, to the access to the doctor, right, is actually largely what their governments do in terms of investment in healthcare. So if you look at your government in Layla's country, right, in Niger, Layla lives in the capital city already. Okay, she lives in the capital city of Niger, and it's already looking like this. So can you imagine how much money is invested in terms of medical care? What is the doctor-patient ratio? How many doctors are there to cover the patient? The other concept you can think about is the bed-patient ratio. How many hospital beds are there to take care of the number of people who potentially may need the hospital bed? So in a DC, the patient-doctor ratio is going to be a lot lower than what you see in the LDC. So in terms of where you see Aiko is from in Osaka, she's definitely going to have more access to more doctors, more hospital beds if there is ever a need for this. What does this access give to her then? When she's sick, she has medical care that can take care of her. That's it. Okay. When Layla is sick, even if Layla were in a state where the family is the most affluent in Niger, and she actually can afford it, the travel time to the doctor, the availability of the number of doctors in Niger may limit the ability of her recovering from diseases. So once again, for economic factors, you will be able to find the information in your textbook from page 185 all the way to page 188. Now, the last set of factors that we're going to look at that will affect Layla and Aiko are environmental factors. Environmental factors, there are three that we will look at: living conditions, access to potable water, and proper sanitation. The content for this area runs from page 189 all the way to page 194 of your textbook. So we will look at the kind of living conditions that these two ladies experience in their day-to-day life. It's very easy and very clear that Layla has very much worse living conditions. So when you live in poor conditions, where you live in things like temporary housing, crowded conditions, your water comes from unclear water sources, or then you have very little toilets, or you are on illegal land. All these conditions transpire to give you the recipe for disaster in terms of exposing you to health and diseases. You will definitely be suffering from poorer health compared to someone living in a developed country that has access to things like permanent house, spacious living environments where you don't have like 10 people living in a room. Okay, where you have pipe connection for water in the bathrooms, more than one toilet for the family. So if we were to think about the overall living conditions, right, it should be very clear to you, and you should be able to give me a few examples of why Layla will have worser living conditions. What are some of the examples of what constitutes a bad living condition, and how Aiko's living condition in a DC is a lot better. So if you are still a little confused about what what would be a good way to compare these two, right? Think of your house as basically Aiko's home, right? Aiko lives in the developed country, DC, like us in Singapore, right? She lives in Japan. The things, amenities that they have in their houses are very, very similar to what we have. Okay, flush toilets. Okay, they have bidets, which are amazing. But besides that, they have flush toilets. They have potable water. You can drink from the tap. And in Japan, it's safe. It's easy, like us. When we think about access to potable water, first concept is what is potable water. You should have learned this in lower sec geography. Potable water is water that is safe to drink. Okay, there are a couple of countries in the world that has potable water available from the tap. We are very fortunate to be one of them. In Singapore, you can just open any tap in any house and the water is good to drink. Okay, in all the shopping centers as well as all the schools as well, the tap water is good to drink. So for Aiko's situation in Japan, right, living in Osaka, the water is also potable from the tap. She doesn't have to go walk 300 miles to collect water every day or every week, right? There is safe access to potable water. She will not need to worry that drinking the water without boiling it will give her a bellyache, will introduce a bacteria into the body, and then eventually she may suffer some bacterial infection and die. Okay, which are exactly what Layla worries about every day. Lastly, we can look at proper sanitation. Sanitation is basically the safe storage and treatment and disposal of waste materials, including human fecal waste. So, how do you classify that you have proper sanitation? Whether your area that you live in, does it have functioning toilets? Does it have flush toilets? Okay, urinals? Are there sewage pipes and treatment plants? Or do you just dump everything into the river itself? Do you defecate in the river? And there's no proper treatment of the waste material? Because if you do, there are countries, there are LDCs where everything is just dumped into a nearby water source. Depends on where you are on the water source. If you are at the upper course of the water source, right, it will flow downwards, and there may be villages further down who by the time they get water from the river, the river has been the water has been, or the waste has been diluted. Now, having the waste diluted is actually a big problem because it looks clean, it doesn't smell too bad, and you may not realize that it contains the waste material from the village that is 100 miles away from you. But still, the bacteria that is colorless and odorless is still in the water. So having access to proper sanitation reduces, I won't say it totally removes, but reduces the likelihood of you suffering from health concerns because of contamination. So when you look at these two ladies and you think forward a little, what do you think will plague Layla in the future? Will she be concerned about degenerative diseases? Okay, will her lifestyle allow her to live a life that's long enough for some degenerative diseases to get a foothold on her? Because we're looking at diseases like high blood pressure, diabetes. All these diseases take a significant amount of time before they get a foothold on your health. So degenerative diseases are probably not her concerns. Okay, does it mean that we always hear about, oh, you have a family that has cancer history? Okay, it's in your DNA. Does it mean that her DNA doesn't predispose her to these degenerative diseases? Actually, no. Okay, she can still have the cancerous DNA within her family tree, but she was not going to live long enough for it to act up. Okay, so you think about it, if the cancer cells, if you are predisposed to having cancer or having intestinal problems, or having whatever kind of degenerative disease, okay, diabetes runs in your family, in your DNA itself. But if you don't live until you are 35, right, the likelihood of you having onset of these degenerative diseases are low. It's not impossible. I'm not saying it's impossible, but it's very, very low. So if you're going to die at 10 because of diarrhea, you're not going to worry about high blood pressure. Then once again, we will look at Aiko. What about Aiko? Okay, what will plague Aiko in her future? Look at her, she's drinking. Gosh, I think that's butterbeer, right? Are infectious diseases a big concern for her? Is she worried about having diarrhea and dying of diarrhea? Okay, doesn't mean that infectious diseases do not worry DCs. The 2019-2020 onset of COVID-19 has taught the entire world a very important lesson, that if you are a DC, if you don't follow certain protocols and take care of your health, infectious disease will still come and haunt you, because there's certain things that DCs, because you're a DC, right, you are more predisposed to. We live in cities, they're very, very cramped, we live very near one another, we have lives that interact with one another all the time in terms of our work and our leisure even. But from this sector of the content, right, if we're looking at a case between Layla and Aiko, infectious disease are not really Aiko's concern, not that much anyways, because if it was a massive pandemic outbreak, it will affect Layla as well. Okay, so what is Aiko's potential health killers in the future then? Probably the degenerative diseases, things like cancer, high blood pressure, heart attack, diabetes. The second point here, does a DNA predispose her to degenerative diseases? Well, it doesn't exclude Layla anyways, so the DNA is the DNA lah. There's a higher chance of her getting treatment for these instead, because the access to medical care is always a little better in the DCs. So what will probably kill her in the future besides old age? I'm guessing probably more of these degenerative diseases, things like heart attack, high blood pressure, and diabetes. So now we come to the end of this KQ1. So what are the indicators of health that we have covered so far? There are two. Okay, you need to know them. You need to know roughly the difference, what actually causes the difference in health between people in DCs and LDCs. Okay, what are some of the social factors, economic factors, and environmental factors, as well as what diseases are different between the DCs and LDCs. What are some of these infectious diseases and degenerative diseases? Who will be more predisposed to suffering from degenerative disease? Who will be more predisposed to suffering from infectious diseases? Try to remember the case of Kayla versus the case of Aiko. So you have two scaffolds, two people to hang all these factors around. And if you cannot remember the details, right, by describing their lifestyle, you should be able to still get some of the social, economic, and environmental factors out. So we come to the end of KQ1 of Health and Disease. I hope that this has helped enlighten you a little bit and given you a bit more clarity on the topic in KQ1. Please remember, once again, this is a supplement to the textbook as well as the notes. It's useful for revision, it's useful for getting a clearer picture, right? But this on its own, this set of slides are very sketchy. Okay, so you have to work with the textbook. So stay tuned for KQ2 and KQ3 of Health and Diseases, which will be launched soon. Have a good day ahead. Right? If you enjoyed the series, please click subscribe to the channel, and share it with your friends.